3 reasons to lean in to membership healthcare. Y'all, you need to lean in, grab your water, grab your tea. I'm Dr. Jade. For those who are new here, I am a board-certified family medicine physician. I'm the founder and medical director of NSPIRE Primary Care here in Las Vegas. We provide the Las Vegas Valley primary care, concierge style, VIP style primary care with your whole healthcare team at your fingertips. We provide telehealth services to Illinois, Missouri, Wisconsin, and Florida. And we are just loving being the healthcare home, especially for my hometown in Las Vegas. I need you all to lean into membership healthcare. Leaning in doesn't mean just jumping in with no information or like going into this unknown journey. It means paying attention, leaning into what's happening in healthcare and why, okay? So I am here to chat about this because, you know, my boots are always to the pavement in the community, and I'm always listening in to hear like, what are people thinking? What's the temperament around membership healthcare? And I've been hearing some things that I want to chat about. So as you join, drop in the chat, where are you joining from? If you have any questions about membership healthcare, the vibe of where we're going in healthcare in our country, let's chat about it. This is our moment, okay? So we are no longer doing Blockbuster. We're now mostly doing Netflix, right? Or Hulu. We're no longer hopping in the good old fashioned yellow taxis. All right. We're doing Uber, and honey, I left Resorts World the other night and they're doing the driverless Zeus. Okay. There's all kinds of, I don't know if I'm pronouncing that right, but we're no longer hopping in taxis. All right. We've upgraded to more modern aspects like Uber, for example. We're no longer going into stores for every little thing. Most of us are going to do what? Amazon, right? And so I'm giving you these examples because in every industry, we are innovating, we are finding better access, we are making things more accessible, more affordable, we're making things at our fingertips in every industry. And guess what? Healthcare is no different, all right? Everyone knows at this point that pickleball is my favorite sport and activity, and it's the fastest growing sport in our country. And guess what? Membership healthcare is the fastest growing healthcare model in our country, and there is a reason, all right? It's because, and we're gonna go over the top 3 reasons, all right? So drop in the chat, where are you joining from? Lean in, and if you are one of those people, and trust me, I get it. I understand that we are coming for the psychology and the culture and the way that we've always done it. So I understand that if you don't know yet and you don't understand this movement yet, that it can just feel the resistance is there. But I want to empower you and encourage you to just simply lean in. Pay attention to why things are the way they are and why the fastest growing healthcare model in our country is direct primary care or membership style medicine. And why is that, right? And it's because there's several reasons, and we're going to go through the top 3 reasons that you should at least lean in, pay attention, and don't get left behind saying, I want to do things the way it's always been done. I want to hold on to my good old fashioned insurance card and just use that for every aspect of my healthcare and use that in every primary care office because that's how I've always done it. You will be left behind. I'm here to tell you and give it to you straight. If that was the best way to do it, that's the way I would be doing healthcare. All right. But it's not. And there's a better way. And so we're going to lean in and talk about it. Okay. All right. So the top 3 reasons to lean into membership healthcare. I'll give you a little backstory. I was at Lady Leaders Pickleball last week. All right. Shout out to all the Lady Leaders in Las Vegas. If you haven't joined the Lady Leaders meetup yet for pickleball and networking with business women professionals, you got to come join us. All right. The next one is May 19th. It's a free community event. NSPIRE Primary Care sponsors the court. And it's just an amazing way for women to connect. But I'm always asking women, like, have you heard of concierge style healthcare or membership healthcare? And I was talking to one lady in particular, and we keep it real, right? And she was just like, oh, yes, it just seems like everywhere. She's like, I'm from the East Coast where there was really good insurance with my insurance card. And I moved to Las Vegas. And when I try to use my insurance card, it takes months to get in. It's a hassle. I get these surprise bills. I just hate it. I don't want to go to urgent care. But then if I try to call the places that everyone says are like the best doctors in town, they tell me that they're concierge or that it's a membership. And it just seems like you either use your insurance card and you're frustrated, or you have to pay extra for this membership. And I could see the frustration on her face, and I understand the psychology around the frustration, but there was just a part of me who was like, oh, if only you knew, if only you knew. So here we go. Let's talk about the top 3 ways to lean in to membership medicine and membership healthcare. You ready? Let's go. Number 1, the access is unmatched, you guys. The access is unmatched. What does that mean? There is nothing like waking up with a healthcare concern and being able to text your doctor and your healthcare team directly and get a response back within minutes, all right? It's unmatched. It's unbeatable. You cannot do that with insurance-based medicine, all right? Even if they have some sort of third-party telehealth company built into the insurance package, that is not your healthcare home. That is maybe an AI bot, okay? It is maybe someone in another state or another country just answering and giving generic options, all right? It is not your doctor, your healthcare team at your fingertips. The access is unmatched. Another thing I hear often is, man, I'm overall healthy. I'm pretty healthy. I don't go see the doctor very often. Like, I just don't know if I'll utilize a membership. So I always tell them, if you're healthy, we want to help keep you healthy. All of us can wake up any day and have a healthcare question or concern. Your team is at your fingertips. And if you're not where you want to be in your health, we want to help get you healthy. All right. So I say that to say we had a healthy couple that joined our practice recently, and they woke up and had a skin rash. It probably was a bite of some sort, maybe a bug bite, spider bite, but this crazy rash just spread all of a sudden out of nowhere. They text us a picture. We got them antibiotics right away, and we were able to avoid a large bill. They said that another person got the same bite, same rash. They went to the urgent care and they got a $500 bill, all right? Versus using the NSPIRE Primary Care membership, they were able to get seen the same day, get on it early, and avoid an unforeseen healthcare hidden bill or surprise bill, okay? And that was with using good insurance, okay? Because they couldn't get in with the primary doctor trying to use their insurance. So the access is unmatched, you all. Unlimited text, email, phone, video, or in office with your healthcare team and doctor, an easy text, email, phone, video away. It's just unmatched. Same day access, same day response. We're on it, we got you. So that's one reason to lean into membership healthcare. Do you have that type of access? Let's get away from thinking about the insurance card as the magic card. Do you have that type of access? Do you have a healthcare home where your team knows you well? Where when you have a new concern that popped up, or you need a refill, or you need anything when it comes to your health, or even just a question about your health, right? Do you have a team that knows you well that is an easy text away? And if the answer is no, then we need to lean in to membership healthcare, all right? Number 2 reason to lean into membership healthcare is that the prevention is the priority. Prevention is the priority. If you are in a insurance-based practice or going to a doctor that takes insurance, it is a reactive, volumes-based model. You have to follow the money, you guys. If they take insurance, they have to cram as many people as possible on the schedule and have the doctor see them for the shortest amount of time, back to back to back. It is a volumes model. Every insurance-based primary care doctor or provider is assigned over 3,000 patients by the insurance company. That is what is needed. That's the volume that's needed just for them to keep the lights on, you guys, in an insurance-based practice. It's a volumes model, meaning your doctor only has 5 minutes to chat with you quickly, give you a pill, a referral, or send you to the hospital or to a specialist. Like, there's only a few options that even the smartest doctor can do within 5 minutes. That is reactive healthcare. That is sick care. That is where people are so frustrated by waiting hours in the waiting room or waiting months to get an appointment, where they just ignore their health altogether and they say, you know what, it's not that bad. I'm just going to wait it out because I don't want to go through that hassle, right? All of that is reactive healthcare. And then you see somebody when they're really, really sick and you have to send them to the hospital or a specialist, right? So in this model, direct primary care at NSPIRE, in this membership style practice, prevention is the priority, right? My incentive is to help keep my members healthy. It's to help them get on health concerns as early as possible. It is to help them prevent and reverse chronic disease and to prioritize longevity and to help them age well and feel their best at every season of life. That is a total model flip, okay? So ask yourself, is the healthcare home that you have or the insurance card that you have, is that doctor incentivized to help keep you healthy? Or is that doctor incentivized to just give you a Band-Aid, a pill, a referral, and rush you in and out as fast as possible? What is the business model? Here at NSPIRE, the business model is prevention. The business model is access. And the business model is excellent customer service and experience, all right? That's what you deserve. So if you're not getting that, lean in to membership healthcare. All right, number 3. This is the one you want. This is the one you want. So come closer, okay? So number 3 reason to lean into membership healthcare, and this is the one that blows minds and is really hard for people to connect the dots. And I'm just going to keep breaking it down for y'all until you understand that the math is mathin', okay? You get cost savings with a membership healthcare model. You are going to save money by partnering and having the foundation of your health plan be a NSPIRE model, a membership-based medical practice, versus a traditional PPO HMO and utilizing the primary care built within those plans. When you do it that way, you are going to spend more, not only in the primary care office, but more for labs, more for imaging, more for medication, and more for the specialists. You get markups by the insurance company on all of that. All right. So if you do the math, all right, for those of you who are the mathematicians out there, put the numbers on paper, and it is an unmatched astronomical difference. All right. NSPIRE Primary Care matched and paired with a affordable, customized, catastrophic health plan option. The price of that is going to beat a traditional plan every single time in cost. So a lot of times people think as membership healthcare as, oh, it's something extra or it's something that's really expensive on top of what I'm paying. Instead, what we're saying is, let's take what you need and actually put together the health plan that's going to give you what you need, the access, the prevention, and the cost that is actually going to give you the absolute best overall experience and package together. So let me give you an example. I had someone I was talking to today that called in and was like, man, I have this insurance plan, which was supposed to be considered good insurance, but the deductible is $7,000, which means that they have to pay out of pocket $7,000 before the insurance will pay for anything. They're an overall healthy person. They're paying over $800 a month for this good insurance. So every month they're giving the insurance company $800. Okay, this is one healthy adult. $800 every month, paying. And then all of a sudden, they wake up and they're concerned about their health. They don't have a healthcare home. They try to call doctors through the good insurance plan with their card. There's no appointments for 3 months. Okay, the only option, because it wasn't an urgent care concern, it was something a little more concerning, and they didn't have a doctor that knew them well, right? They weren't established with NSPIRE yet. So where did they go? They went to the emergency room. They give the emergency room their insurance card, and guess what? They leave the emergency room with a $6,000 bill. However, their deductible is $7,000, which means they had to pay absolutely 100% of that $6,000 bill, and insurance paid $0. Why? Because their $7,000 deductible hasn't been met, and they will have to pay at least $1,000 more before insurance will begin to help kick in for anything. Meanwhile, every month they are paying $800 a month. Okay, lean in. Do the math, all right? That one visit to the emergency room was 2 years worth of an NSPIRE primary care membership, okay? And the health concern that they had, they could have texted NSPIRE. We could have triaged that over the phone the same day. We could have got them into an appointment the next morning at NSPIRE and treated that outpatient without ever needing to go to the emergency room, all included within their affordable monthly membership. Do the math, all right? So that would have been $6,000 saved, all right? So we have several examples of how we do that. We do that with medications. We have wholesale rates on medications where you might be paying a $20 or a $10 copay for something that's actually $3, all right, if you're an Inspire member, where you might use your insurance card to get your mammogram or an x-ray or a CT, right? We had someone get an MRI and it was over $800 and it would have only been $300 if they used the Inspire member pricing. And so I just need you all to understand that we're not saying don't have insurance. What we're saying is insurance is meant for catastrophic, high cost things in your healthcare. And there are more affordable ways to customize and pair that with an Inspire membership. Inspire should be the foundation of your health plan, all right? Where 90% of your healthcare needs go, where your team is a text and email away. And then for the 10% of care that is actually high cost and catastrophic, like emergency rooms, surgeries, or if you need to see a specialist, then that is where we have either like a high deductible health plan, an indemnity plan, or a health share. We talk about which catastrophic piece is going to be the best for your needs to make your overall healthcare costs lower while your overall healthcare experience is higher quality because Inspire is at the core. Are you picking up what I'm putting down? I am trying to give y'all the game on how to get better access, better prevention, and cost savings in your health plan and healthcare experience. So those are the top 3 reasons to lean into membership healthcare. What questions do you have? I see some of you have joined. I know some of you are from Las Vegas, but where are you all from? We just went over the top 3 reasons to lean into membership healthcare. I know lots of people are like, what is this? Why are doctors taking, memberships now? What is happening? Doctors are committed to giving people high quality care. And the only way we can do that now is through this model called direct primary care. But the hack is we found a way to make it not only more accessible, not only prevention focused, but also cost savings. Now, if you are a business owner, lean in. If you are a decision maker for a company, lean in, because here's the part that has just multiplied this whole movement. It's not just individuals and families that are taking advantage of Inspire as their healthcare benefit. We now offer, for the last few years, our corporate partners, our small and medium businesses throughout the Las Vegas Valley who are using Inspire as the core to their health plan, pairing it with a catastrophic plan that is more affordable for their entire company, and concierge-style Inspire Primary Care is now available for all of their employees, lowering the cost of care for their business, tax write-off for their business, increasing the quality of care for all of their employees. If you know a business owner in Las Vegas who has an open enrollment of July 1st, many businesses are either a summer open enrollment or a fall open enrollment. So if you know a company in Las Vegas that has a 7/1 open enrollment, connect us with them now. All right, connect us with them today just so they can have a conversation with us and understand how we can literally transform the numbers for their business and increase the quality of care for all of their team. It has been mind-blowing. I just left an activation session for a local business who's a corporate partner of Inspire's. I got to meet the team. We enrolled all of their employees, and they all now have concierge healthcare built into their health plan. So that has been an absolute pleasure. All right, shout out to one of our local furniture stores who just became a corporate partner. Shout out to one of our local finance companies who just became a corporate partner. We are lowering the cost of healthcare for businesses and increasing the quality of care for employees, in addition to caring for families and individuals as well, okay? So I'm gonna keep dropping your questions. I'm gonna go through and see what we got here, okay? All right. It says, Tommy Scott 5 says, yes, I'm from Las Vegas. Perfect. And I'm currently my only employee. So definitely reach out. We have entrepreneurs are one of our biggest models, our patients in our practice or members in our practice. What happened with our practice is we've started attracting lots of business owners and entrepreneurs or solopreneurs, and then their companies started to grow. They started to grow their teams. They started to offer Inspire as the healthcare benefit for their teams of 2, 3, 5. And then we were able to then customize and partner with broker partners partners, etc. And now we are the healthcare benefit for even larger companies, 50 plus employee companies. Most of our companies are in the 10 to 50 employee space, but we also have companies that are 50 or more. So we have custom health plans for solo entrepreneurs, all right? And we have custom health plans for businesses that have 10, 50 plus employees. All right. So this works on any scale. But the strategy shifts a bit depending on which bucket you fall into. All right. But the system, the top 3 reasons to lean in doesn't change, whether you're an individual or a company. All right. The access is unmatched. Prevention is the priority, and it is cost savings when you do the math. All right. So lean back in and change, go back to the beginning. If you're watching the replay or if you just popped into our live, go back and watch the replay. All right. I want to meet with you all and connect with you all in the community. So let me chat and let you all know before I pop off to my next appointment with our next member. I want to let you all know that I love connecting with you all in the community, okay? So if you are a lady, men, pause, all right? Ladies, lean in. First of all, happy early Mother's Day to all the ladies out there, mother figures, those who are, aunts and all the things, those who are mourning their moms. My thoughts are with you, okay? But I want you to lean in. We do have a Mother's Day special going. Don't miss it, all right? Moms take care of everybody else. It's time for us to take care of mom. Let's give her the gift she actually needs, all right? And that's the gift of health, all right? We have some specials going on for moms. You can text our team the word mom, and we'll let you know about our Mother's Day special. If you just want information on how our practice works, text us the word info, all right? We're at 702-867-0017, 702-867-0017. And if you are a lady, we have the Lady Leaders Pickleball meetup, and that is our networking space for women professionals. We meet on specific Tuesdays, all right? Our next one is going to be May 19th. Tag us or DM us the word or comment the word pickleball, and we'll give you the information for our group chat if you're not already in it. It's a free event where we get together, network, connect, and play pickleball. It's like our version of going to the golf course and closing deals and connecting, but over pickleball. So ladies, we want to see you there. The group has been fantastic. Our group chat has grown to over 120 women at this point. And so that's the space for lady leaders, okay? And men, come back and join us, okay? We have the Las Vegas Leaders Lunch and Learn. So if you are a business owner, a decision maker in the community, we want to see you at our Lunch and Learn, especially if you are a business owner with a team and you have a 7-1 open enrollment. This room is especially for you. Spaces are limited. You would just RSVP with the link in bio. Again, it's a free lunch, all right? And we will be sharing how to not only save busy professionals on their healthcare and increase the quality of care, but we'll also be sharing specific strategies for those who have teams, okay? That's a networking lunch. So it's always a room full of incredible business owners and decision makers. And it's a space where we connect and network. So that's for men and women. That's the Las Vegas Leaders Lunch and Learn. That one is June 5th. Okay. And we want to see you there. We have a few more spaces left. So definitely RSVP before the room is full. And I think that's all the things, you guys. Let me go back through and see if you guys have any other questions. It says, I'll talk to my wife. We have 2 salon suites in Vegas, 17 employees and owners. Let's connect. Absolutely, let's connect. That it's a game changer for that whole scenario, for the salon suites, for them as individuals. If you wanted to offer something as a company, or if you wanted to just connect us where there's a team meeting, and then we can share how we really save them as individuals. We've already connected with some of the local beauty schools, and we're the corporate partner for some of them. So this is absolutely something that would be amazing. We'd love to see you at our June 5th Lunch and Learn as well. And we'd love to see your wife at Lady Leaders Pickleball, and let's connect, all right? Click the link in bio, go to NSPIREPrimaryCare.com. The contact page has our email address, and I'd love to connect further, okay? All right, you guys, those are the top 3 reasons to lean into membership healthcare. It's my pleasure to provide my hometown, Las Vegas, quality healthcare, all right, that is not only improving access, improving prevention and longevity, but also saving individuals, families, and businesses money. It's a joy, all right? So lean into membership healthcare. Don't let it intimidate you and get all in your head, because it's not the way it's always been done, all right? Let's go. Let's lean in. We are no longer just taking what's been given to us, because there is a better way. I'll see you guys next time. Bye.